Jeg hedder Sara Ingeribada, og jeg er 10 år gammel og har psoriasis.
As crianças me chamavam os adolescentes de cobrinha e faziam brincadeiras que realmente me deixavam mais irritada.
Patients suffer in many different ways, and this is being reflected to a certain extent by the stories they usually tell.
I'm never invited to a birthday party.
They make it responsible for private problems that very often develop.
It was not good to see me in the mirror.
Og så var der min venindes lillebror. Han spurgte meget til det. Meget, og sagde, de grimme negle, hvad er det? Så sagde jeg, at det var psoriasis, så det smitter ikke. Men nu har han lært, at man ikke skal sige det. Han vil bare se dem, og de ser seje ud og sådan noget.
They make it responsible for divorce, for not having children, being rejected by their children.
Like I was a monster.
Having a skin disease at young age is very difficult. For example, in the classroom no one wanted to sit next to me.
And they are very often also afraid that since psoriasis traits may be given from generation to generation, that they may become guilty for transferring psoriasis to their children.
As crianças me chamavam os adolescentes de cobrinha e faziam brincadeiras que realmente me deixavam mais irritada do que eu já estava, porque eu sinceramente não gostava de ter a doença, né?
Even there was a teacher, I was on a very Christian school, Christian they say, even a teacher told me, he asked me in front of the classroom and told the class, so this is an example for punishment of God.
Jeg var 6-7 år gammel, når jeg fandt ud af, at jeg havde psoriasis.
I found that when I'm doing something that I love, I forget that I hurt, I forget that I have pain, I forget that I have psoriasis.
Psoriasis is one of the most common skin disorders known today. It affects 1 in 50 of the world's population, roughly 125 million people. There are several different types of psoriasis, but it usually appears in the form of patches or silver scales on areas of reddened skin. These scales can be scratched off and tend to shed easily. The most common areas where these patches, or plaques as they are known, occur are the scalp, lower back, elbows and knees, but they can also affect other regions of the body. Psoriasis is what is referred to as a waxing and waning disorder, which means that there are times when the condition seems to be clearing up, only for it to return with a vengeance at a later date. The condition varies from sufferer to sufferer. Some people only ever seem to have a few psoriatic patches, while others are subjected to more than one form of psoriasis and experience widespread eruptions.
Bom, quando eu tinha 13 anos eu comecei a desenvolver a doença, a psoríase, e eu já praticava esportes como basquete e handebol e eu precisei parar de praticar. A psoríase ela apareceu nas minhas mãos e nos meus pés e capilar, no couro cabeludo, e realmente foi uma coisa que me espantou muito e, enfim, impressionou bastante a minha família.
But I know I never covered my skin. I always had skirts and shirts with short sleeves. I never covered because it was my fault, so why should I cover something which is... I was not ashamed for it, and still I think you have not to shame you for your psoriasis.
Com o aparecimento da doença, né, minha mãe me levou a diversos médicos e eu somente constatei o que eu tinha aproximadamente 2 anos depois, aos 15 anos, quando eu fiz biópsia.
As there is no apparent reason as to why people develop psoriasis, it is impossible to prevent the condition. There are, however, some things that are thought to trigger the disorder, such as having some kind of skin injury, getting sunburned, having recently suffered from a chest infection or sore throat, being on certain drug treatments, and, as with many other conditions, being stressed.
Após o diagnóstico da doença, né, eu fiquei curiosa para saber qual foi a origem, o que startou a doença em mim, e eu descobri que a minha avó já possuía a psoríase.
I've had psoriasis since I was 12. I'm now 45. It started out on my scalp and my elbows and my knees, and I was diagnosed at first with a fungus infection because my doctor couldn't identify what I had.
Psoriasis is not contagious, it's not an infectious disease, but at the same time also it's not a cosmetic disease. It's a severe disease that impacts basically on all areas of life: private life, social life, family planning, professional development, self-esteem, the way patients think others might look at them, the way they have to hide their skin lesions from others in order not to be rejected.
Descobri também que a psoríase é uma doença que não é contagiosa e que o tratamento e o controle era possível.
There are a number of patients who come and say, this disease has destroyed my whole life. They make it responsible for the lack of success professionally.
Well, career-wise, it affected my career very badly because I had gone to a technical school to work in administration, and I was working at a bank. I was doing very well, starting the career ladder, when the neck started to be inflamed before I knew I had arthritis. And I had to take off time from work as we tried to figure out what was wrong with it. And when I went back to work, I wasn't able to lift things, I wasn't able to do my job, and then I wasn't able to sit in my chair for very long, and I finally had to quit, and I was I applied for disability shortly thereafter and got it immediately. And so it has affected my life a lot.
Living with psoriasis can be both physically and emotionally frustrating, not to mention distressing. The plaques tend to itch incessantly, and if scratched, they can become cracked and sore, especially if they bleed.
Inicialmente eu fiquei com muita raiva por eu ter adquirido essa doença, porque as pessoas tinham um nojo. Então eu procurei de alguma forma conviver com a doença durante esse longo período. Como eu também descobri que é uma doença ligada totalmente ao sistema emocional, eu procurei ficar muito mais calma e ter uma qualidade de vida muito melhor do que a que eu tinha antes.
As well as the physical aspect of coping with this condition, sufferers can also find themselves subject to bouts of depression and loneliness as they struggle to cope with low self-esteem. In addition, psoriasis is related to a number of other conditions, including forms of heart disease, stroke, diabetes, and obesity.
The most important advance that there has been in our understanding of the disease has occurred quite recently, when we have started to appreciate that chronic inflammation, as occurs in psoriasis, is associated with a wide range of manifestations that predispose to cardiovascular disease. That's myocardial infarction, angina pectoris, or for instance, stroke.
Eh bien, je souffre du psoriasis depuis 1994 suite à un problème de cœur. J'ai fait un petit arrêt cardiaque et quelques semaines après, je me suis retrouvé avec des plaques.
And these are metabolic syndrome, which is a condition which can be found in more than 40% of psoriasis, but also can be found in about 20% of the population, and is marked by truncal obesity, by insulin resistance or predisposition to diabetes, by hypertension, by dyslipidemia, and all these factors compound themselves to make the patient more prone to myocardial infarction, angina, and the like.
Psoriasis affects about 2 to 3% of the world's population. There is no gender discrimination, so there are just as many male sufferers as there are female sufferers. Neither is the condition dependent on age. Psoriasis tends, however, to make its first appearance between the ages of 10 and 40, most commonly during the teenage years.
It was difficult because I was a teenager. I wanted to live like a teenager. I wanted to go out. I wanted to live, of course. But for me it was different because my life was only putting cream, hospital.
Psoriasis is a disease that has manifestations that go beyond the skin. These are called comorbidities, which are diseases or conditions that predispose to disease, which are found more frequently in patients with psoriasis. What are the importance of these comorbidities? There are several ways to look at them. First of all, they can compound or make more difficult the management of the disease with systemic treatments. For instance, cyclosporine can worsen hypertension or renal disease or diabetes, or methotrexate can worsen the liver disease or the liver condition in those patients. But on the other hand, we are starting to know that by treating psoriasis and its inflammatory manifestations, we can somehow make those patients more amenable to a control of their increased risk for myocardial infarction. The first one to be acknowledged many years ago was psoriatic arthritis, which is a variant, quite aggressive variant of arthritis, which can be present in from 10 to 30% of patients and shares many pathogenic pathways, mechanisms of disease with psoriasis.
Over the following years, it got progressively worse. So by the time I was 25, which was 13 years later, I had psoriasis from head to toe, 85% covered. We could not get it under control. And I also had severe psoriatic arthritis.
When I was 25 years old, I got arthritis. I got problems with my hand and my wrists. And when I got serious problems, I went to our family doctor, and he sent me to a rheumatologist.
It also started to affect my right wrist, and subsequently now, as I'm 45, my neck is fused and my lower back is fused. A lot of people say to me, you wouldn't believe it, but they ask me if I'm a ballroom dancer because my posture is so nice, and I say, well, thank you very much, but actually I'm fused this way, I can't move. And I'm lucky that I fused the way I did naturally, because my doctor said if it had fused incorrectly, they would have to break my neck and reset it and then put a steel rod up.
I always had problems with my skin, but it's a part of me because at young I don't know the life without it, so it's a part of me, like the color of my eyes is a part of me. But I got problems with my arthritis because that affects your life more. You can't hide it. It affects your holidays. It affects your sport. It affects your relation with people.
My case was so difficult because my doctors could not get the inflammation under control. I have tried just about everything on the market to control the psoriasis and psoriatic arthritis. And even when I started taking the very aggressive treatments, we found that one treatment wasn't enough. So on top of the more aggressive therapy I'm also on a systemic therapy.
As yet, there's no cure for psoriasis, but many people experience long periods when their condition seems to become more manageable or even clears up altogether. This can happen all by itself or because their lives are less stressful, but most people find that some kind of medical treatment has helped them.
Alors actuellement je suis les UV avec des cachets. ça fonctionne pas trop mal, donc il me reste encore quelques séances à faire. Donc on s'aperçoit que quand on fait ces séances, parce qu'on l'avait déjà fait il y a 3 ans, que ça m'avait fait beaucoup de bien, donc je m'étais retrouvé à peu près avec presque plus rien, donc c'est quelque chose qui fonctionne, mais malheureusement la vie fait que dans notre vie privée, régulièrement, on a des problèmes, et quand on a ces problèmes, il ressort très rapidement, et dans ces cas-là, il est incontrôlable. Donc on revient voir le docteur et on réessaye encore autre chose. Bon, et puis là, la dernière fois, c'était les pommades, et ça a très bien marché, et malheureusement, encore une fois, comme j'ai aussi quelques associations où je travaille et tout, où il y a eu des problèmes, et pouf, hop, ça a réaugmenté, donc, et là on réessaye encore, je vous dis, les UV, donc j'espère qu'avec tout ça, ça va s'enlever progressivement, mais on sait très bien que s'il nous arrive quelque chose, un effet dans la vie privée ou travail très fort, c'est là-dessus que ça revient automatiquement, le psoriasis revient très rapidement.
Prescribed treatment for psoriasis includes skin softeners, tar preparations, emollients, vitamin A and D derivatives, topical drug therapy, steroids and dithronol preparations, all depending on the severity of the condition. These are known as topical treatments and are applied directly to the skin's surface. For more serious psoriasis cases, patients may be referred for light therapy with ultraviolet radiation or systemic therapies in the form of tablets, injections or infusions. Biologic treatments, one type of systemic therapy, have a targeted effect on the body's immune system and address the inflammatory processes, which can lead to psoriasis.
Treatments are very good now. There was an evolution and with the biologic, and for me it was like a second life, in fact, because in the past I was in the prison and now I'm free.
Regardless of the treatment being used, the most important thing is to keep the skin well moisturized. Those patients suffering from more severe incidences of psoriasis should be referred to a dermatologist, either as an outpatient or an inpatient.
Psoriasis should be one of the worst diseases to get. In terms of the WHO definition, burden of disease is defined by the number of years lost due to premature death because of a disease and the years of healthy life lost due to a disease. When you imagine that the disease onset usually is at late adolescence, then you might imagine that a patient who starts with psoriasis has 40-50 years of healthy life lost. During this time, if they have severe psoriasis, they develop a number of comorbidities which might influence their life expectancy. So at the same time, they also lose life due to premature death. And according to this definition by the World Health Organization, psoriasis should really have a major impact, which is not yet recognized to the extent.
It is very rare to see a child under the age of 2 suffering from psoriasis, but as many as 1 in 50 children are affected by the condition.
Childless psoriasis, as we say, is a childless for all. I mean, to have a small child who needs so much treatment and attention will in itself change the whole pattern of the family.
Det startede med, at jeg var i Finland, og jeg så min negl begyndte at se anderledes ud, blev lidt gul, skrumpet-agtig. Og så mine forældre det, og så når vi kom til Danmark, så tog de mig hen til lægen, og de fandt så alt muligt ud af, at jeg tror det var neglesvamp. Og så spurgte de, hvis de skulle rive den af, og jeg troede det ville hjælpe, så jeg sagde ja. Så kom jeg over til en hudlæge, Og han sagde så, at det var med det samme, at det var psoriasis. Og det er det så.
Jeg tror ikke, det gik op for mig før nogle dage senere, hvor man lige skulle have lidt tid til at forarbejde det, og lige finde ud af, jamen, hvad er det her egentlig for noget? Ikke? Man har jo godt nok hørt om psoriasis, men jeg forbandt jo altid psoriasis med nogle rødlige hudpletter på kroppen. Aldrig på neglene. Det var en ny viden.
Da vi så fik at vide, at Sara har psoriasis, det var naturligvis et lille chok til hele familien. Men også en lettelse for at få en diagnose, efter vi havde været igennem så mange undersøgelser og mange læger. Og det at få videre og få en diagnose, så kunne vi komme videre. Det at psoriasis er kronisk sygdom, det skal man så lære at leve med. Og hele familien skal lære at leve med det. Og især naturligvis Sara, og hun skulle få videre alt, hvad der er vigtigt for hende, at hun kan klare sig.
Jeg kunne godt tænke mig, at folk vidste lidt mere om psoriasis, om det medicin, man kan få. Og tænke lidt mere på børnene, at de også har det. Og selvfølgelig voksne.
Vi har dog et håb om, at nu hvor hun er startet på en ny behandling af biologisk medicin, at det vil gøre det meget bedre for Sara, at hun bliver helbredt på sin neglepsoriasis. Og vores håb er jo engang i fremtiden, at medicinindustrien kan udvikle noget medicinpræparat, som kan gøre, at man helt kan blive helbredt.
Jeg gemmer ikke min neglepsoriasis mere, fordi at jeg ved, at alle folk har et eller andet i verden. Eller så, og fordi at de er blevet pænere. Altså de er ikke mere skrumpede og gule og tørre mere.
Because I found that when I'm doing something that I love, I forget that I hurt, I forget that I have pain, I forget that I have psoriasis.
E hoje eu tenho uma vida absolutamente normal, que, enfim, eu posso fazer o que eu quiser e a psoríase não me impede de nada. Hoje eu sou advogada, tenho 30 anos e me sinto muito bem.
Jeg kunne godt tænke mig at være skuespiller, når jeg blev stor, eller danser, eller designer.